All right, good morning, everybody. I am Jessica Wergo, for those who don't know me, although I see many familiar faces on this call. I'm with the Community Foundation of the New River Valley, and we are one among many partners that are with the NRV Livability Initiative, including the NRV Regional Commission and several other folks who for the last several years, as you may know, have been working on raising up different projects in the NRV related to priorities we identified several years ago in the Livability Initiative report. This year, we have held a few different sessions to take a deep dive on aspects of work in the New River Valley. We did one earlier this year on housing. I'm sure many of you attended, learning about the regional and local housing study and some resources that are aiming to address some of what we found in that study. And then this fall, we've been focusing on health and wellness in the New River Valley. And last month, we had a great session from Ashley Hash of Carillion, who talked about the community health assessment that's done every 3 years by Carillion Clinic and several other partners. And today, we're going to focus on how that community health assessment is informing work on the priorities that are identified and how several groups are coming together to create Healthy Roots NRV, which is our regional way of attempting to address some of the needs we're seeing related to health and wellness and to build on some of the collaborative efforts that are already existing here. So I'm going to take some time to introduce Healthy Roots. There are many folks that are on the call today who have been part of this effort. And so I encourage you all, if I've missed something, please feel free to speak up about what we're doing here with Healthy Roots. We'll have some time, plenty of time at the end of the session to have some questions and discussion. But if you have questions come up, go ahead and put those in the chat. We've got somebody monitoring the chat, so we'll have time to answer those questions and talk in a bit more depth about Healthy Roots. Okay, so let's go ahead and get started. First, by reviewing a little bit of what we learned about last month through the community health assessment. So as some of you may know, the community health assessment is done every 3 years. It's led by Carillion Clinic, but there are several different partner groups that help to disseminate the survey, collect additional information, and in particular, look at that information and decide what are the key priorities in our region that we need to consider as we move forward to improve health and wellness. So these are the results that Ashley shared of the 2021 assessment. And for those of you who have been working in our community, you will know that none of these are a particular surprise. Some of them have been needs that we've seen for some time. Others have really risen to more prominence following COVID. So they focus on mental health and particularly access to mental health services, socioeconomic factors that affect health like housing, transportation, and poverty, and then health behaviors, being able to know about the resources that are available, to access food or recreation in ways that can help support a healthy lifestyle. And as you can see from these, some of them are not what you would consider traditional health and wellness, meaning being able to access a particular doctor or specialist. These are really all of the different factors in a community that affect your ability to be healthy. Fortunately, there are a lot of great groups that are working in some of these areas. And so part of what Healthy Roots aims to do is really leverage that great collaboration that's already happening to address what we've learned through the health assessment. So first and foremost, how did we get here? This effort emerged after the 2018 health assessment. So as I said, every 3 years, this assessment is done. And you can see here some of the priorities that came out of that 2018 assessment, many of which are very similar to what we're seeing again in 2021. But once again, these were issues that relate very broadly to a lot of different organizations and individuals working in the region. And the challenge for the group that's working on this is to figure out how do we create a holistic way that the New River Valley can address health and wellness and all of these different aspects that affect it. And how do we do so in a way that can be effective and sustainable and engage a lot of different partners? So a group came together initially to talk through what we learned about in the 2018 assessment, and to start off with a community conversation in 2019. We held this in November of 2019 with about 100 different folks who were there to learn first and foremost about the community health assessment's findings in 2018, to take a look at some community collaborations that are working well, and you can see those listed here, and what we can learn from those that might allow us to address health more broadly. And then most importantly, we were able to talk as a group about the priority issues that were in the community health assessment and begin to focus in on what can we do as a region to start, where is there energy to be able to start working on some of these issues, and what are some of the most significant needs that we see. So it was an excellent conversation that gave the planning group for Healthy Roots and all the partners a lot of good information about where those of you working in this field really see both need and the ability to address those needs. So I wanted to just dig a little bit deeper into what we learned from that, because this really helps form the foundation for a lot of what Healthy Roots aims to do and what we hope to focus on in the coming years. So we did a couple different exercises during the session where we asked people to move around the room based on their response to different questions. And they moved to parts of the room based on these categories you see here, like access to care, affordable housing. So the first question asked, what do you see as the greatest barrier for the clients that you work with? And you can see that transportation, poverty, and affordable and safe housing had a lot of folks go over there because these were significant barriers. We then asked the group, if you could address one priority area, what do you think would have the greatest impact for those that you serve and in our region? And this changed a little bit. So again, poverty and low average household income was pretty significant, but we also saw access to care and creating a culture of healthy behavior as an issue that folks thought would have the most significant impact. Now, as many of you know, we can spend a lot of time identifying barriers and issues that have impact, but if there's not a lot of energy to be able to address them, it can be difficult to move things forward. So we also asked the group, which priorities do you think have the greatest energy to make an impact? And here, overwhelmingly, the idea of having a culture of healthy behaviors was something that folks thought we could really rally around, help to disseminate information and to create opportunities for folks to live a more healthy lifestyle and to have the information they need to do that. Lack of knowledge of community resources, substance use, and access to care were also significant. So we kind of put all of these together too, just so you could see in combination, where are things where they are significant barriers. If we address them, we can make a significant impact, and there's energy around those. And some of these, like poverty, lack of knowledge of community resources, access to care, and culture of healthy behaviors, all sort of help us to understand places where we might focus. That's not to say that the other issues are not incredibly important and worthy of attention and work, but any collaboration, any community needs to look at where can we start this work, knowing that we're going to be able to move through different priorities as we learn and have an impact. So the Healthy Roots team really took these as a way of understanding where there were some priorities. And we also took from that conversation that there really is a desire to have a collaborative group. Like we see in other parts of the state, we had folks from Healthy Chesapeake come speak at this event as well as a model. Healthy Roanoke Valley is another model. So we saw that there was energy to create something here in the New River Valley that was collaborative, and we could use those connections and relationships to address these issues. So a huge part of Healthy Roots NRV is kind of not recreating the wheel. Many of you are part of a lot of excellent collaborations in the region, and you know that the New River Valley is really known for working well together and creating opportunities where folks can leverage one another's resources and information to address an issue holistically. So part of what we saw as an opportunity for Healthy Roots NRV is to be able to take some of the existing collaborations that are here in the New River Valley, to learn from them, to support them, and to bring them together under the Healthy Roots umbrella in a way that would allow them to address some issues that are cross-cutting across those collaborations and really give them some additional capacity to make an impact. So I'm just going to walk through a few of these so you can see some of the groups that are here. And this is not meant at all to be exhaustive of the great collaborations that are happening in the NRV, but just to share with you those that are likely to be part of our Healthy Roots framework and ones that we know are directly related to those social determinants of health that we talked about. So the first is PATH, the Partnership for Access to Healthcare, that started back in 1995 with a lot of different organizations that are focused on providing health and human services and increasing access to healthcare. They established things like MedRide, for example, that provides transportation for folks to access medical appointments, and they've been a key partner in the health assessment. And this is all about sharing information and helping the clients that we serve to be able to access the healthcare that we need. More recently, coming directly out of the Livability Initiative is the Aging in Community collaboration that started in 2014. We learned through the Livability Initiative that the population in the New River Valley of folks 65 and older will double by 2030, and that we lacked the kind of housing and social services that were appropriate for serving an aging population. So this group works to be able to develop, advance, and expand services, resources, and policies for older adults in the region. They've done things like provide critical home repairs through the Lifespan Friendly Homes program, allowing folks to remain in their homes by building ramps, widening doors, putting in grab bars, and addressing some energy efficiency issues so we could lower energy costs for some of the folks we serve. We also created the Aging in Place workshop and workbook that helps folks to think through the financial, housing, health, social, and financial information that they need to be able to age in their communities and in their homes safely and comfortably. And so we do that workshop for different groups and also encourage them to take a look through the workbook, which asks probing questions and also provides a lot of different resources. In 2016, another collaborative group came together around the issue of early childhood education and access to childcare. This is a group of both for-profit and nonprofit organizations that support children and families. So childcare centers, public schools, social service agencies that's been working for the past several years. This group has focused on building connections between organizations and ensuring that folks had information about other services that could be available to the families they serve. We've done that through some virtual and in-person sessions. We've also engaged in some advocacy, particularly during COVID, to help folks understand the importance of childcare to working families in the NRV. And then have also recognized some of the extraordinary people that work with young children and families. So early childhood educators and advocates who are really emphasizing the importance of those first several years. And then finally, we have NRV Thrive, another group that started about 5 years ago, focused on food access, being able in particular to provide nutritious food to people across the New River Valley. This is a group that's created a food assistance directory in the past few years, providing information about all of the different food access organizations here in the NRV. So our food pantries, soup kitchens, and other feeding programs, their eligibility requirements, the type of food they provide. We've also provided some grants through the Community Foundation to be able to provide more cold storage for groups so that they could provide more fresh foods. And we're focusing more recently on food sharing. So when organizations within the network have an excess of a particular donation they received, how do they make sure that that goes to another food pantry rather than being wasted? This group is focusing on being able to make sure that we've got as much healthy food as possible going throughout the region And how do we also provide the kind of education and resources for folks so that they can make that healthy food and make it part of their lifestyle. So as you can see from all of these, there are a lot of really good groups already working in areas that address the social determinants of health that we learned about in the community health assessment. And what we've learned at the Community Foundation in providing some support for all of these is that they're doing really well, they're continuing to grow, but they need some additional capacity, whether it's through staffing or funding, but also the ability to network with other collaborative groups. We've seen over time, for example, that there are certain issues that come up at each one of these different collaborative groups, and they may be slightly unique depending on the topic, but they're all coming up as shared issues. And that's information sharing, being able to know about what's available in the region, coordination of care, being able to improve referrals and ensuring that an individual or family can get their needs met holistically. Sort of a no wrong door kind of approach. Transportation, of course, has come up at all of these, whether it's being able to go to a grocery store with fresh food or to get to a childcare center, and then mental and behavioral health. And we've seen that in particular over the last year, that's affecting people's ability to age in place, to access childcare, et cetera. So the challenge that's before Healthy Roots is to be able to support collaboration that's happening in the community related to health and wellness, and create opportunities where these groups that may be working in seemingly siloed areas can work together to address some of these cross-cutting issues, as we call them. So this is really where Healthy Roots comes in and what we've been working on for the past about year and a half. So what we're creating here essentially is a super network. For those who have worked with the Community Foundation before, you know that the collaborations that we oversee are what we call collaborative networks, where we're really trying to build relationships between organizations. So Healthy Roots is meant to be kind of a network of networks, so bringing all of these groups together under a broader umbrella to support them. So what we've been working on over the past 18 months is to be able to plan for creating this super network, Healthy Roots, so that it can be effective and sustainable over time. So first, we looked again at the 2021 Community Health Assessment and made sure that a lot of the things that we were addressing through Healthy Roots were indeed still relevant. And this just shows you some of the responses in the community survey, a part of that health assessment. Those in bold are ones that are addressed in one way or another by our existing collaborations. And that's not to say that those not in bold are not of importance, but certainly give us a sense that we have some capacity already in the region. So with that in mind, in late 2020, with the Community Foundation as kind of the fiscal agent, our Healthy Roots group applied for some funding from Carilion Clinic to be able to really plan for Healthy Roots. And that included the things here. To be able to have this kind of sustainable regional effort, really have to be able to build a structure that can sustain itself over time. And so we wanted to learn from other models that are across the state and country and be able to think about what do we need to put in place so that Healthy Roots can eventually be its own nonprofit organization that has the capacity and the stability to be able to serve the community long term. So we created couple different groups that have been working on the governance structure, funding, staffing, and evaluation plans for this work. And I'm going to talk about these very briefly, just so you can see where we are in that process. Most importantly, this work is made possible with a lot of different folks at the table. This is not by any means an exhaustive list of all the different collaborative groups that have been involved. But you can see that we've really leveraged some of the resources we have here in the region, because it's not about replacing what's already happening. It's about being able to raise up some of the good work and opportunities already here and coordinate them. So you can see whether it's the health district, our local hospital systems, leveraging our universities and local governments, that we've been able to kind of create a group that can think broadly about health. All right, so what's a super network? The idea is that Healthy Roots will be an umbrella organization for the collaborations that are in the area. That includes the ones we've talked about: First Steps, PATH, Thrive, and Aging in Community, as well as a newer group that's emerging with several of the folks that have been involved in Healthy Roots, focused on healthy behaviors and particularly creating a healthy workforce. So the idea is that all of these would fall under the umbrella of Healthy Roots NRV as an overarching organization, and that they would be able to relate to one another in a variety of ways, but most importantly, that Healthy Roots could also create task forces that focused on issues that are cross-cutting, these ones in the kind of purple ovals, like transportation, coordination of care, information sharing, and mental and behavioral health. The idea is to create kind of an intentional way that these groups that are already successful can work together and connect with one another around issues that are shared. And they'll have the staff capacity, some shared resources, and coordination to support that effort. So a big part of that is making sure that Healthy Roots and its leadership is representative of the different groups that are a part of it, and also of the broader region. So as part of the grant that we received, we worked on what's the governance structure for this. In the first couple of years, Healthy Roots NRV is going to be sort of part of the community foundation until it can become its own nonprofit organization. And we're going to be creating an advisory council to ensure that the different collaborations and others are represented. So this includes having representatives from each one of the collaborative groups that have already expressed an interest in being part of this effort. And as other groups emerge or other existing groups are interested, we want to ensure that they're represented at that leadership level. We also know that there are a lot of other groups that work in areas addressing health and wellness that may not be plugged into these networks already and need to be at the table. So we're going to be recruiting some additional organization representatives that are regional in scope, are collaborative, relate to the social determinants of health, and most importantly, bring a kind of equity lens to the work that we do by ensuring that those from underrepresented populations are at that leadership table. So what is the council going to do? This is really the coordinating body for Healthy Roots NRV, and it's meant to create opportunities for communication and collaboration across all of the different participating networks. It will also be a repository for regional health data. So we know that in addition to the community health assessment, there are several other great regional data sources. And we see an opportunity to collaborate around how we're gathering that data, and then also to be a repository that's accessible to the region. And as I mentioned before, one of the main roles of the council is to look at where there are issues that are cross-cutting and create opportunities for these groups to work on them together. And then we also see this council as a precursor to a board, eventually for an independent organization. So we want to make sure that it's developing all of the different policies, procedures, and systems that will ensure Healthy Roots is a sustainable agency. We've also worked on a variety of other plans, and if you are interested in learning more about these in depth, I'm certainly happy to share, but you can just see some of the things that we've been working on here. A major part of what makes networks successful is the ability for them to buy in some way, even at a very small scale, so they can help support the work of Healthy Roots broadly, as well as the individual networks they're a part of. We also see grants, private contributions, and government support as a way to sustain this work without competing with those that we serve. We are working right now on engaging a consultant that can help implement all of these plans. So that will be a key part of our staffing plan. And we see the opportunity for paid staff, as well as being able to work with our local universities to get additional interns, volunteers, et cetera. And then finally, and most importantly, many of you who do collaborative work know that it's incredibly difficult to evaluate how effective a collaboration is. Oftentimes, we don't see the results of effective collaboration for many years in advance, or we don't know what might have happened if we didn't collaborate. So it's important that we think at the outset about how are we going to know if we're doing a good job or making progress. So we've developed a plan that evaluates the network overall, as well as some of the different programs within it. And this is modeled after some existing work that's been done on First Steps, Focus, and other networks with support from some researchers at Virginia Tech. So all of this is part of the work that we did over the last 18 months to kind of plan for what Healthy Roots is. So where do we go from here? So we're kind of ready to actually implement all that good planning that we did. So as I said, we're going to be working on engaging a consultant, hopefully within the next couple of months, that will provide support to our planning group to actually make this a reality. We want to raise awareness through events like this about what we envision for Healthy Roots. We understand that this idea of a super network, of pulling together a bunch of different collaborations, can be a little bit difficult to get your head around. And so we want to make sure that folks see opportunities to plug in and have a chance to learn about all of the different components that make up this regional effort. Well, we've talked to the different groups that I've mentioned already today and their interest in joining. We'll formally invite them so that they can join the advisory council and recruit those members. So as I said, there are a lot of different people who have been involved in this work. The Community Foundation has been kind of the seat of it, but certainly not the only ones involved in thinking through how this can benefit the community. And we're also really anxious to hear from others about what else we can do and ways for folks to get involved. So this is an evolving process, most definitely, and hope that some of you who are on the call today might be interested in diving in a little bit deeper with us and getting involved as we kind of stand up this collaboration. So I think that is my full song and dance for the group today. Let me stop sharing. And I don't know if there's any questions that have come up, or for those who are part of this work, if you'd like to add anything.
Good morning, this is Pam Ray from the New River Health District. First of all, I just want to say that this idea started out 3 or 4 years ago, finally came to fruition. We could not have moved it forward without the help of the Community Foundation. And Jess and her staff said, you know what, we can help with this, it's important. So I just want to point out that the work that's being done, if it hadn't been spearheaded at this point by Community Foundation, we probably would not be here. So thank you very much, Jess, and all your staff over the last several years who have made this happen. We really appreciate it. We need it so much.
Thanks so much, Pam. Appreciate that. And of course, all your work in it as well. Other comments from folks who have been involved, questions from the group? I see, Pat, you have raised your hand. Go ahead, Pat. What's your question?
Well, I guess I had 2 things that are slightly unrelated. One is, as we develop this public presentation about Healthy Roots, I wonder if you could add an example from the Healthy Chesapeake and from Healthy Roanoke to describe not their, I know it's their circumstances, but to describe a way in which their collaboration has yielded something. I think that would help conceptualize the opportunity for us to act together. That would be great. And the second, and I know this is premature, but do you guys see already some financial grant sources that might be available to us? And can you, for those of us who aren't in this business, could you describe what those might be if we were to actually identify something around which a major collaboration could happen? Where would the money come from?
Yeah, absolutely. So you make a really good point about sharing some examples, Pat. So I'll certainly put that in my materials going forward. In terms of some funding resources, we're already starting to explore some foundations. So groups like Robert Wood Johnson Foundation or the Jesse Ball DuPont Fund are interested in investing in these kinds of collaborative networks.
Okay.
Started some of those conversations. Now, those are not, easy ins, so to speak, because they are major funders. But I think that what we're trying to do fits their sort of general theory of the kinds of things that they want to fund, particularly looking at investing in collaborative approaches or collective impact approaches. that, but I think that one of the things we thought a lot about through building the funding structure was that we don't want to rely only on grant money, and that there needs to be some level of buy-in from the different networks or organizations that are involved. So we do have a system as well of kind of membership that's on a sliding scale, very affordable for organizations to be able to put some money in that will be used by Healthy Roots overall, as well as supporting the individual networks like First Steps or Thrive, so that they've got some skin in the game, but they also have the ability to inform how that money is spent. And so it's more sustainable over time and being able to just go after grant funding.
Well, and you really can't pull together a major grant without paid staff in place to make it happen. You can't run a major grant like that with just volunteers. You know, you got to have somebody who's really there working on it.
Exactly. Yeah. Thanks, Pat.
Jen, I've got a question about if folks are interested in providing support, offering support, how would they go about doing so?
Sure. So they can contact the Community Foundation, and I'm going to send out to all the folks that are on the call today some contact information, and I can drop that in the chat as well. My email, which I can then connect everybody to our larger group, but that will give the opportunity to learn a little bit more, and then we can talk about specific ways folks might want to be able to get involved or support the effort. And there was also a question in here just real quick about subnetworks. And again, I know that the concept and some of the terminology is crazy, but a subnetwork would be something like PATH, First Steps, Thrive, groups that are all fall underneath Healthy Roots NRV. Okay, I see another hand raised. Go right, Dave, go right ahead.
So thank you, and Jessica. And so I'm new to the group, so I'm just kind of learning the ins and outs. So I'm with Freedom First Credit Union, and I've been a part of the network in Roanoke Marketplace under Healthy Roanoke Valley. That's and been on the Community Health Needs Assessment Action Team here in Roanoke. And I just wanted to make reference, to Pat and given an example of how that has worked. And so some of the outcome measurements in the Roanoke marketplace determined that one of our neighborhoods in the Roanoke area, which is 24013, which is the Fallon Park community of Roanoke City, predominantly low income, mostly consistent of white individuals. But we had a group of folks that, based on the community health needs assessment, knew that transportation, access to healthcare, affordable housing, and poverty, rated the top of the list of some of the outcome measurements. And this happens to be the same zip code as Carilion in the Roanoke market. And so a group of us came together and looked at the elementary school that actually serves that marketplace. They were undergoing a major renovation to improve the school, and wanted to look at some of the social determinants of health and how they can lift up the community as well as the caretakers and parents of the students. And so, systemically, from the Community Health Needs Assessment, a group of us came together, and it was Carilion Clinic, Delta Dental, and Freedom First Credit Union. And we went out and raised $1 million in capital to add an addition onto the school. And what the school will be to provide pediatric services specifically to the students. And we have a longitudinal study that is looking at the asthma effects as it relates to the students at Fallon Park. And we know that from the children that are coming into the ER at Carilion, a majority of them come from that zip code and are frequent sufferers of asthma. And we knew that asthma was translated to absenteeism, truancy, different behavioral issues and outcomes. So a group of us came together to decide how we can tackle this issue. And so we've raised the capital to put an addition onto the school, which was a recently renovated school, and to provide the pediatric services for the students, so that we can, Carolina is staffing it with a nurse practitioner that will be allowed to treat the students and monitor their asthma, on a consistent basis. But Delta Dental is then coming in and providing the oral health care component of it. Freedom First is coming in with our financial empowerment center concept, because Carolina quickly identified that, how can a healthcare provider solve poverty, and how can they solve transportation, and how can they solve, affordable housing unless you have a financial provider that comes along with you. And so I'm in the community development department of Freedom First. We are making a conscious effort to move and be more methodical about what our outreach is going to look like in the NRV. And so this project is launching, like I said, in January. Carolina has hired a project coordinator that's going to coordinate all the efforts of the individuals in that neighborhood. But we're providing the financial education and the stability and sustainability. Our educators are very engaged in the wraparound services that are available in our community. But we then are looking at some of the social determinants of health and then trying to gauge the outcome measurements that come along with that, so that we can truly say that our concentrated effort in this community is working. And then what we want to do is to scale that up later and certainly offer this concept in more rural communities, outside, the Roanoke market. So that would be an example of, what has come out of this community health needs assessment and the collaboration and the work, in the Roanoke area. So I think, just getting the right people at the table, it can happen. And there's an example of that.
Dave, that's so helpful. Thank you so much for sharing that. I think, certainly as we do more to raise awareness of healthy, being able to share those specific examples. And I think in particular, what we envision for Healthy Roots that you guys are really living through that example you gave is the way in which so many different types of organizations like financial institutions, insurance providers, et cetera, are really part of this work and have a role to play within it. And so it's a great example of sort of what we hope to do in building relationships that may not seem at the outset to be logical, but indeed are actually fundamental to being able to do this work. Thanks for sharing that so much. Other questions or comments from the group?
Jess, there's some comments in the chat. One from Eric about Blacksburg Transit and getting at the general point that right now we're in this workforce shortage. Yes. And how that plays into the network and where you see that link. There's also a question related to how does this relate to Unite Us and Unite Virginia, which is also a similar regional effort.
Great questions. So first, to Eric's question, we have a group that we've kind of called our Healthy Workforce Group that's really trying to look at issues of a healthy workforce, particularly as they relate to the idea of a workforce shortage. And so what are some of those things that we can do in supporting employers who may have difficulty in recruiting or retaining staff, particularly health-related issues that may address those, and how do we help them think through some different policies and procedures, or being aware of some other resources that are available in the region to be supportive of their employees in a way that might help them to attract or retain them. That's not to say that this effort is going to solve what is a massive difficulty across all sorts of different sectors. But there is a group that's kind of looking at that question in particular. And I think then as it relates to transportation, this is going to be one of the first sort of task forces that we pull together, not only of the different networks that are kind of fall underneath Healthy Roots, but all, transportation providers in the region, to try to figure out how we can think creatively about transportation, which has been one of the sort of biggest and hairiest issues to address in general, not even bringing into account what we're dealing with workforce wise. So I don't have a solid kind of solution there, but it's definitely something that we're focused on, and creating kind of a group specifically focused on workforce. With regards to Unite Us, for those who may not be familiar with it, you can actually see on the Community Foundation's website an overview that was provided by Unite Us. So this is an online platform that facilitates referrals between service providers, particularly in the health and human service sector. So if you have a particular client that has a need your own organization doesn't provide, you can put that need out there and refer it to other organizations. So many of the networks that we envision being part of Healthy Roots have joined Unite Us and see that as an opportunity for referrals and to be able to track it through that system. So what we envision for Healthy Roots is not in any way, a replacement. It's kind of complementary to that effort, so that in addition to folks being able to use the Unite Us platform to make referrals and track those referrals over time, we can create more relationships and, of course, encourage more people to join that platform. So very much one of the tools we see being used by the Healthy Roots group. Other questions or comments from others who are involved in the planning effort that I didn't hit?
I have a question. You mentioned subnetworks and then task forces. And as someone who's working in one of the areas that wasn't bolded on the list, I can see that there would be a lot of potential for integration, but not necessarily sure how to plug in. Do you have any thoughts or guidance for those of us that are working on different issues and how we fit into the big network?
Yeah, absolutely. So I think a couple things, we envision with that advisory council that some organizations that are critically related to social determinants of health, but may not be plugged in to the existing networks. Many of those I think will have a place on the council because they're addressing some of these broader issues. And then part of the role of the advisory council is to identify where it can either support existing collaborations groups, where it might be able to help facilitate the creation of collaborations that can be part of Healthy Roots, so kind of adding other networks as they develop, or whether there may be a task force that needs to be created. So the notion of a subnetwork is really referring to kind of issue-specific networks like Thrive that focuses on food access. Maybe there's one that develops around housing. But the task forces are really, what are some of the issues that are cross-cutting for many of these groups? So, I could see housing being one of those too. So I think it's meant to evolve over time as the needs evolve. And if folks don't see themselves right away in the networks that are mentioned, that doesn't mean that there's not a place. It's just figuring out working with Healthy Roots to try to figure out what's the most appropriate way to play a role through an existing network, or seeking some support to create a newer collaboration. And the hope is that Healthy Roots can be kind of a place where folks can come and get some support for that kind of effort. Other questions or comments from folks? Well, I want to thank everyone for being here today and learning a little bit more about Healthy Roots. As I said, this is evolving, and we are looking for ways to continue to raise awareness about it, but also to engage more people. It is not meant to be kind of a finite and solid thing, but really meant to evolve over time as our community needs it to, in order to address those issues related to health and wellness. So I hope that if you're interested, please feel free to send me an email. I put my email in the chat. I'll also be sending out a recording of this and ways to get involved with Healthy Roots. And you'll be hearing more next year as we get some additional capacity through that consultant to be able to get out even more so into the community, engage folks, and find ways that people can really plug in and offer their expertise and insight into this work. So with that, I hope everybody has a wonderful day. Also keep an eye out for additional things coming up from the Livability Initiative. In particular, we are in the process of planning our annual Livability Exchange, which, as many of you know, is an opportunity to learn about different projects across the region. That will be on March 17th, 2022. We're going to send out save the dates and just keep an eye out for more information and ways to engage with the Livability Initiative. All right, thank you, everyone. Have a wonderful day. Bye-bye.